The child cries in agony. No high fever, no visible injury. Just their tiny hand clutching the ear, as if trying to hide an unbearable pain. This is not just ordinary crying, but a scream from within, from a precise spot behind the eardrum. Here is where middle ear infection occurs, the illness that wakes mothers in the middle of the night, turning silence into a hidden battle between immunity and microbes. It often starts after a cold or an infection in the nose or throat. When the eustachian tube, a small canal connecting the nose to the ear, becomes blocked, fluid gets trapped behind the eardrum, creating the perfect environment for bacteria or viruses to multiply. The result? Rising pressure, a throbbing pain that makes the child cry non-stop. Symptoms begin with intense crying, poor sleep, loss of appetite, repeated tugging at the ear, and sometimes a mild fever. The child cannot say, "My ear hurts," so they say it in their only language, crying. Treatment doesn't start with medicine. It begins with observation and patience. 8 out of 10 cases improve without antibiotics within 2 to 3 days, especially if the child is active and has a low fever. What can a mother do? Give paracetamol or ibuprofen to relieve pain and fever. Apply a warm compress to the ear. Keep the child's head slightly elevated to help drain fluids. Gently clean the nose with saline solution during a cold. Breastfeed frequently, as breast milk is the first shield of immunity, thanks to its antibodies. But if the pain continues for more than 2 days, or the fever rises above 39 degrees Celsius or 102 degrees Fahrenheit, or fluid starts to drain from the ear, then a doctor should be consulted immediately. In some recurring cases, the doctor may perform a detailed hearing test and possibly insert a small ventilation tube into the eardrum to help drain fluid and prevent the infection from returning. Remember, never let your child feed while fully lying down, and avoid smoking near them, as smoke irritates the ear canal and weakens ear immunity. Middle ear infections are painful, but they don't last. Every little ache trains this tiny body to defend itself and teaches the mother to distinguish between a passing tear and a scream that comes from deep within.